There are so many products out there, and sometimes I think for a lot of people, perhaps finding the best product for your skin can be a little intimidating, a little overwhelming, because again, so many choices. So you already touched on this a little bit. Something that affects me a little personally is the moisturizer issue. So you go out, you see there's all these types of moisturizers. What do you recommend to people when it comes to a moisturizer, and what kinds of questions are you getting from your patients about finding a moisturizer that really works for them?
Yes. Well, in my practice, I have a variety. I have teenagers that have acne and oily skin, and then I have adults, and I have also children have eczema and they have dry skin too. So if you have very, very dry skin, then you would go toward more of a cream.
Okay.
If you have more oily skin, but you still want to hydrate the skin, you would go more towards the lotions. And then if you really have a breakdown in the skin, then you would go more to an ointment. So those are the three basic things. Then now, if you want to have something that has to help repair sun damage, then or environmental influences, you would go with something with a peptide or vitamin C added to a lotion if you wanted something that, if you had rosacea.
Okay.
If you are more dry and you wanted those types of products to help repair the skin, you would go with the vitamin C, peptide, green tea, and a moisturizer with a cream base. And then they have body creams that have the same types of things, because you want to, don't forget your neck and chest and your hands.
Important.
And so it depends on what the patient is actually looking for, and so we decide which moisturizer would work for them. And sometimes patients just don't need moisturizer.